Welcome to this month's webinar. So February, oh man, already the end of February. This webinar, we're going to talk about ergonomics awareness training. And so I'm going to start off with just some of the general introductions and housekeeping. So my name is Sarah Snabel. I am one of the co-owners of Pro Ergonomics. I'm a registered kinesiologist. I'm a certified professional ergonomist. And I've been doing ergonomics now for quite a number of years. I think we're up to 13 plus years. And my personal experience comes from a variety of different industries. I started out in healthcare. I've worked in a lot of municipalities, some manufacturing, some industrial. I tend to work with a lot of jobs that are a little less cyclical. That's generally how we kind of streamline it. The team of us, Pro Ergonomics, I'll give you a little rundown on Pro Ergonomics because some of you are new. I've looked at the registration list. Some of you are new. Some of you maybe have worked with Pro Ergonomics in the past. But we are a team of ergonomic consultants. And kind of what makes us so great as a team really is that we do bring a lot of different things to the table. So whereas I kind of work with some cyclical, non-cyclical jobs, my colleagues, like Alex, for example, works with a lot of cyclical jobs. She's very, very heavy focused on manufacturing and industrial. And so we really do strive hard to work as a team. When we're working with our clients, you know, you're always getting the person who is, in general, the most experienced in the field. But because we have this network, you know, we're always networking behind the scenes together to make sure that our clients are getting the absolute best service. Yeah, we're all registered kinesiologists. Most of our team is certified professional ergonomists. Really, what our goal is to reduce injuries and to try to customize our work, our services, to make sure that they are the proper fit for you as the client, right? So it could be, you know, we have some ideas of how we might do training, for example, which is what we're going to talk about today, but always trying to customize it so that you're not just getting a canned product. Ultimately, a canned product doesn't really work well for every single industry, right? There's some content for sure that could be repeatable, but customizing it so that it specifically works for your workplace is always the best. So that's really what we strive to be, is to be the professionals and the experts in our field and give you the absolute best service when it comes to ergonomics. In terms of just general housekeeping about the webinar, if you have any questions at any point, please write them in the little chat bar. You should have that window on your, I think, the right side of your screen. And then at certain times, like I'm going to be talking, so I will make sure to check the questions. Excuse me. And I'll save most of the questions to be answered towards the end of the session. However, if you have something like my sound keeps cutting out or, you know, something technical like that, you can also post there and that will draw my attention to it sooner. My colleague, Julie, is also logged in today to help field any questions or some of those technical glitches. So yep, you can send your questions right there. You just send out a message. Perfect. Great. So that is the intros. Today's session is, again, about ergonomics training. So the goal really here is trying to talk about training and give you some ideas on how you might be able to deliver training. And I'm going to talk about ergonomics training specifically because we are ergonomists and that's what we specialize in. So how to deliver some ergonomics training in a way that makes it more engaging, in a way that it empowers your staff, empowers your employees to actually make changes themselves. It's not always about getting a brand new piece of equipment or some kind of fancy magic bullet tool that's going to solve all the problems. There are times when training can be a really good control or a complementary control to really help them to help themselves, right? So that's what I want to focus on today. My outline, my agenda is very simplistic for today. Really, when it comes to training, and I mean, again, I'm talking about ergonomics training, but this sort of framework that I'm talking about could be applied to really any topic of training that you're going to deliver. But the first thing I want to go through is just going over some goals and objectives. What do you want to talk about in the training? What do you want your staff to get out of it? And making sure that you're clear on that before you even get started. That's going to help you to deliver or to plan your content. What information do you want to present? examples that you might use, tools or media, those kinds of things. And then the delivery. And this is where I would encourage you to try to think outside the box. One of the trickiest things is to deliver training and kind of keep delivering it the same way, because that's how you've always been doing it. That is often how training is done, right? We do it this way because we have so many employees and this is the easiest way to do it, or this is the way we've always done it. But there are potentially some tweaks that we could make that might make that training just a little more interesting, just a little bit more engaging. In this day and age, sometimes we are trained to death, essentially. We go through a lot of training. Employees will go through a lot of training, safety training, ergonomics training, procedural training. I mean, the list goes on. We need to know a lot of things to do our job. And so, thinking about kind of going to be speaking to this as in terms of you guys listening, that you are the presenters or you are the ones that are going to be delivering training. So, if you're delivering the session, you want yours to be the most interesting. You want everybody to be as excited about it as you are, or try anyways. And so just ways that you might be able to think outside the box. And that's what I hope to bring to the table today in this webinar. So starting is the goals and objectives. So before you take on any training initiative, it's trying to think about what you want to achieve, right? So are you just trying to tell them, hey, ergonomics is? What do you want them to get out of it? Are you trying to, update them on a new policy and procedure? Hey, we have a new reporting system for MSD injuries or for near misses, or something along those lines, something more policy driven, right? Maybe we want to be able to help reduce injuries. We want people to work smarter and not harder, and we want them to take home that message and actually take action. Maybe the Ministry of Labor has come in. This is an interesting one over the last 2 or 3 years. One of the more common orders that we've seen is that an employer needs to deliver training, right? So you need to have an ergonomic, or they call it an MSD prevention program in place, basically saying that you're going to address, that you are aware of the MSD, the musculoskeletal disorder hazards in the workplace, and that you're going to do something about that. And the doing something about that will almost always include some type of awareness training. So making sure that your staff are aware what are the MSD hazards in their job and what they can do about that. So in general, Ministry of Labor kind of writes 3 general types of orders when it comes to ergonomics. 1 is the program or the training. 2 is, the program. 2 is the training. And 3 is doing ergonomic risk assessment. But the training, I mean, maybe so then in theory, maybe you're trying to check up a box because the Ministry of Labor has come in and given you this recommendation. But then also now you're delivering the training as part of your program. And so the ideal outcome of that would be that people are now understanding what ergonomics is, they understand how it applies to them, and they understand what they can do to make the job safer for themselves, right? For themselves, for their coworkers, how they might be able to report things. There could be a lot of different goals that you are trying to achieve, but I would try to narrow it down in terms of a session. Like if you're doing general ergonomics awareness, the goal is that you're trying to educate people on ergonomics, but really the big thing is on how ergonomics applies to them in their job. Sometimes it could be that you are delivering training to a joint health and safety committee, right? Trying to educate them on a little bit more in depth on ergonomics. So how they're going to be including ergonomics or identifying MSD hazards as part of their inspections. And then maybe you're providing information to your employees on, processes that have changed or giving them a heads up. But lots of different reasons, but all of this will give you some direction in planning your training session, because it might look a little bit different for each of you, kind of depending on your industry, depending on which group of frontline staff we're even talking about, the diversity of the staff or the tasks that your staff do, the ones that you call frontline staff. It may also depend on even what your current ergonomics awareness situation is in your company, right? Are you starting from scratch or are you a little bit more advanced? Like, would you say that your employees already have a good handle on what is ergonomics? and now you're looking at kind of the next level where, you know, the baseline is we've never done anything about ergonomics, and you know, maybe you need to start from ground zero. So first things first is kind of getting out some goals and objectives, and then thinking about who your frontline staff are. Okay, so you might have several different groups or types of frontline staff at your company, and so you'll want to take into consideration how you're going to effectively deliver training to really engage them, right? Can you or should you do the same session, like an identical session for all of your staff, right? You might have staff who are working on the assembly line. You might have staff who are working in the warehouse, and they would all be considered frontline staff. You would have your maintenance or housekeeping staff. Possibly you've got some customer service or sales representatives. People are traveling out in the field. Excuse me, all of those people would be considered your frontline staff, right? The ones who are directly either interacting with your product or interacting with your customers. But ultimately, there are some basic ergonomic principles for sure that will apply to all of these groups, right? Obviously, when you think about working on the production floor versus working in customer service, I'm picturing customer service working more at a computer or on the phone. The job tasks are quite different. You know, we're talking about standing all day working with tools, working on a cycle time, versus customer service where you're interacting with people, doing a lot more talking. The job tasks are quite different, but the kind of general content that I might be delivering to them would be similar, would be the same, really, that base, that foundation. So what is ergonomics? I can give you a definition on what is ergonomics. What are MSDs? What are musculoskeletal disorders? I can give you a definition on that. I can tell you how they develop. You know, all of that information is the same. What are some MSD hazards? What are some things that contribute to MSD injuries, right? The big three in the ergonomics world is force, posture, repetition, right? I can talk to you all about that. And that would be the same type of session. But beyond that, if you're wanting to make it really customizable and make it applicable to each of them, this is where you might want to consider streamlining or customizing the session to speak to your different groups of frontline staff, right? If you really want it to hit home, then you're going to want to give some examples of how force applies to your production staff and how force applies to customer service, because your examples are likely very different, and you're potentially going to lose people if you're not talking about stuff that's relevant to them. Which really is my big point here, right? If you, in this day and age, again, we go through a ton of training, and really what we need to do is we need to cover off is how does ergonomics apply to me? And in this case, me is the worker, the employee. How does ergonomics apply to that person, the person you are training? How does it apply to them, right? You want them to listen, you want them to take interest, you want them to take action afterwards. So after you deliver this content, you want to be able for them to leave the session, remember what you said, and do something about it. So the main thing is, how does ergonomics apply to me? How will ergonomics help me do my job better? How will ergonomics help me to do my job safer? How will it keep me injury-free, right? There's lots of things about ergonomics that, you know, it helps with productivity and some of those kind of bigger corporate goals. But the bottom line is the employee needs to know what's in it for them in order for them to give you their attention during that session and then to actually do something about it afterwards. So I really cannot stress this enough that you can give a generic session, right? You can give an online module about ergonomics awareness, but if you are not giving very specific examples to that person's job or asking questions and getting them involved, you're likely to miss this point, right? This, how does ergonomics apply to me? And that whole goal of having an engaging and exciting training session to make a difference is likely to be missed, right? So that's I will continue to come back to this. Must, in a good training session, have this, how does ergonomics apply to me? That's where I do think that you could customize for each of the different groups, and I am going to come to that with some ideas. So as I mentioned, there are some foundations, some basics of ergonomics that you could likely generalize, that you could distribute to all of your staff. say again, your production staff, your warehouse staff, your maintenance and housekeeping staff, your customer service, your finance and other office employees. There is likely an information session that you could provide to all of them that would cover off the basics. You could kind of think of it as a step one, step two. So everybody gets step one, and then step two will look a little bit different, kind of depending on which group you are, right? So your customer service staff are likely going to get, maybe their step two is going to be a bit more office ergonomics focused. But maybe your maintenance staff, their step two is going to be a bit more about manual handling, right? Manual material handling or lifting focused, because that is way more applicable to them. So this first component, this ergonomics awareness, which is really the type of training that I'm talking about, again, coming back to where the Ministry of Labor will often suggest that you need to have some training in place to support your MSD prevention program that teaches people what are the workplace MSD hazards, right? What is it that they're exposed to in their job, and then what can they do about it, right? Are there work methods that they could do that either increase the risk? Similarly, are there work methods that they could do that would decrease the risk, right? So talking about different techniques or postures, or not using this tool or using this tool, those are all things that would affect their level of risk. And then some practical strategies. And again, those could be generic in your kind of intro session on how to manage those hazards, right? So if something is forceful, you want to try to reduce the force or improve the posture. You know, there are very general or high level tips that you could provide here. But the big thing I think that is constant, no matter which group of frontline staff you're talking about, is, you know, what is ergonomics? What are the workplace MSD hazards, like in general, and work methods that might increase risk? And this is my favorite definition. It's the short and sweet definition of ergonomics, right? It is fitting the work to the worker. You can go through all of those long, more scientific, wordy definitions for sure, but this is a nice summary, right? So ergonomics is all about how the human, the person, the worker, how they interact with their system, right? And their system is the work environment, the tasks, the tools, the equipment that they use. It's all of the things that they have to interact with in order to do their job. Technically, ergonomics applies to work and also like work, life, and play, right? So at home as well. And the system would be all of those things that they interact with. The ultimate goal is always reducing injury risk, those MSD injuries, those chronic strains and sprains. Again, another common slang or a catchphrase is working smarter and not harder. So, you know, doing things more efficiently, doing things that improves performance, improves productivity, improves efficiency. All of these things are the goals of ergonomics. And really, if the work is fitted to the worker, then this should happen. In reality, we are all different, right? Every single person is a little bit different. We are not all the exact same height, the same size, the same shape. We vary a little bit. In the workplace, we might all be asked to use the same equipment, right? There's one model of chair that's provided for everybody in the office. The assembly line is one height. The shelving and racks are at set height, right? They're not necessarily custom to each individual person. However, there could be some modifications to the tools, to the equipment, to the layout that would help people to do that job. It is not okay. It's not acceptable, really, to say that, you know, only people who are 5'2" are working at this station, and all the people who are 6 feet tall are working at that station over there. And trust me, we have seen some workplaces where this happens. So yeah, but that really is not good practice. So in a training session, you definitely want to have this definition about what is ergonomics, and just kind of having a conversation to make sure that people are on the same page, right? When I started doing ergonomics, when I was like fresh out of school, I remember having to explain what ergonomics was a lot, like saying, oh, I do ergonomic consulting, or I do ergonomics here in this hospital. And people really had, like, you know, family, friends, really didn't really have much idea of what I did. And I would say that that is changing now. Now, whether I'm talking about it a lot more and they get it, or maybe it is, I think, more just in general, society is now starting to understand it. Like, it's way more popular. We realize that we need to have it. Workplaces are including it a lot more. But I still think it's a really good foundational question, and slide, or however you want to deliver it, that you would cover in any ergonomics awareness training. We're probably also going to need to talk about some MSDs, just in general, making sure that you understand, or that your employees understand, that MSD is a musculoskeletal disorder. It could also be called a repetitive strain repetitive strain injury. There are different terms that are used to describe the same injury, but in Ontario here we use MSD. And getting them familiar with some of the symptoms that might include, right? So being able to recognize some of those early warning signs. It's possible that you might kind of talk a little bit about the progression as well, understanding that in the beginning, it may not necessarily be a full-on injury. Like, it doesn't have to necessarily be something that's diagnosed by a healthcare practitioner, right? If you're getting shoulder discomfort, then you want to do something about that sooner rather than later, to make sure that it doesn't progress into, you know, something actually diagnosed like frozen shoulder, right? And getting them familiar with the fact that if you feel something, it's a matter of what can I do differently. Maybe you do have a reporting system, so it would be also introducing at this point how or when they would report, and the process or policy that you have in place to go along with that. But most importantly, it's catching it early, right? Being able to, I shouldn't say it's like listening to your body, but being aware of those early signs and symptoms, and not necessarily just ignoring or brushing them off as, oh, I slept funny last night, or no, it's just because I was super stressed, and so, my neck is bothering me, and, always giving it an excuse that you'll deal with it later, or that it's not a big deal. It may not necessarily be a big deal, but it could be a big deal if you are consistently ignoring it. So I think that this is really important. So what is ergonomics? And then talking about the injuries that ergonomics is actually trying to prevent. And then talking a little bit about those hazards. So, if you're going to get a chronic strain or sprain, right, which is another kind of the category of injuries that comes with MSDs, right, remembering that they are chronic. They don't just happen overnight. It's not you slip and fall and you twist your ankle. Well, yes, technically that's a strain, but that is a very acute injury. You know exactly what caused that ankle injury, what caused that ligament strain. It is from that fall, right? A lot of things when it comes to ergonomics, it's chronic wear and tear over time, right? Weeks, months, years. Your common hazards, there's a list. These aren't necessarily all of them, but these are kind of the common. And I always say the big three, but more often than not, I've actually been breaking this more out into four. I think we all, like within our team, we often have, because it's force, posture, and repetition. But within there, we also like to talk about static posture. So force is all of your lifting, carrying, pushing and pulling, potentially even gripping, any kind of force exertion. Awkward posture and static posture. So awkward posture is anything outside of neutral, right? Those awkward twists and bends and reaching overhead, or really bad wrist postures. I think the pictures that I have up here are all relatively neutral postures. And then repetition being how often that you do something. And static sort of falls into that. Static can kind of fall into the awkward posture, and it can also fall under repetition. And to be honest, when we talk about it sort of in both categories, because repetition is how frequently something is happening, but static is also the length of time or the duration that you might be exposed to something. So those are some of the categories. And in any kind of general training, again, if I am teaching somebody about ergonomics, I'm likely to start with these kinds of headings. And then from there, that's where you would try to make it a little bit more custom. You could, if you were doing this as an ergonomics awareness session to all of the employees in your organization, you might list a couple of generic examples, right? So in the warehouse, some force examples would include, using the pump truck to move skids of product, right? That's a force that is happening to push and pull the pump truck. It's also some force to push and pull the actual pump truck itself to jack that skid up off the ground. You might see some awkward postures, for example, in where would you see some awkward postures? Another example would be in the warehouse, could also be reaching to the top of the skid, or maybe like in that picture in the bottom right, the skids have some space all around them, but if they didn't have space all around them, you might be reaching to that product on the very back row. So now your awkward postures are going to be shoulder and back, right? You can give all of these examples. However, notice that I've given 2 examples from the warehouse and none from the customer service or your sales folks. So it's possible that you want to keep this section sort of short and sweet and high level, or consider this to be the point where you're going to now customize. So yeah, just want to make sure that we talk about those hazards. I also think it's important that when you talk about repetition is to talk about, just to make a comment about how repetition is defined. It's a really good one to review because of the term repetitive strain injury. Lots of people think that just because their job is repetitive, that they are going to get an injury, or vice versa. Oh, well, my job is not repetitive, or, you know, just ultimately everybody kind of thinks their job is repetitive, right? You do the same thing over and over again. Sometimes it's a 30-second cycle time, or sometimes it's just that you do the whole same process day over day, and it's not really a 30-second cycle time. But repetition and having a very set definition is kind of tricky. That applies to all of these people, right? You know, is it just because you work at a 30-second cycle time versus in customer service where you don't have a cycle time, and then maybe your injury risk is lessened? Not really. We just need to make sure that we are understanding the effects of combining all of these hazards, right? So in your general session, your kind of opening session here, it's talking about hazards, giving some examples, and ultimately explaining that it's the combination of these hazards. I might not be able to change the fact that that box or that product, that pipe weighs 45 pounds, but I can choose, or I can change how I interact with that. Use better postures. I can use the lift truck or the high adjustable table or the pump truck or the lift assist. I could use something to also be able to change the amount of force that I have to exert to interact with that. So these are all some examples that, you know, that I would have in your training session. Remembering, to really maximize your engagement, you're wanting to use specific and relevant examples. Remember, how does ergonomics apply to me? How does ergonomics apply to the workers that you are talking to, or training, or delivering this content session, delivering this session to, delivering this content to? When it comes to injury prevention strategy, so this is kind of my outline for a training session, is kind of what is ergonomics? How does it apply to me? What are some MSD injuries and awareness? What are some things that cause it? What is an MSD injury, like signs and symptoms? What are some things that cause MSD injuries, like the force, posture, repetition? And then what can you do about it? So this could be work methods that either increase or decrease your risk, giving people some tips on how they can actually manage their exposure to these. And this is the part of the training that I think is going to vary a lot, or will vary the most, depending on the group that you're delivering the content to, right? Where they work, what hazards would they be exposed to? Work method controls are also going to vary depending on the task, the environment. So this is really where we want to talk a little bit more about customizing this aspect of the training. So that would kind of cover off your, like, so far I feel like I've covered off what I would cover in the basic ergonomics 101 awareness content, right? But then thinking about, where would this session actually be delivered? Are you out on the plant floor, or are you in a classroom? Right? Where does the whole training session, like let's say you've got a goal that you want to deliver ergonomics awareness training to your frontline staff in the production warehouse, to make sure that they understand what ergonomics is, and we want to be able to teach them to lift safely because there's a lot of manual handling in their job. Great. So we definitely need to go through some of that theoretical content, which I've covered. But if we want them to be able to do manual material handling, or to talk about lifting or postures, is the classroom in a PowerPoint type setting, is that really the ideal location? Right? Do we want to maybe deliver it online? I don't know, these are just things to consider, right? Does online training work for some of your staff? Do they have access to a computer? A lot of people who do work on the frontline staff, the frontline, like on a production floor, for example, may not have easy access to a computer, or a lot of people who work out in the field may also not have access to a computer, or may not do a lot of computer work, and so use that as an opportunity to take a rest or have a nap, right? So thinking about each of your groups, again, this is going on feedback, that we've gotten over the years, but we're talking about what is ergonomics, and then how we might best deliver this what do I do about it? I now have the information on what is ergonomics. I understand the hazards, and I want to be able to make changes and do something about it in my job. These injury prevention strategies, you want to think about how you can make it practical and relevant and actually engage your staff. So this has actually been like a really interesting focus. It's something that we have been working on as a team really hard, actually, in the last year or two, probably the last 2 years especially, is that when we deliver a training session, what is the best way to do it? Again, we are consultants, so when you hire us to do training, we're coming in and you're paying us to do training. So we want to make sure that we are giving like really good training. We want to make sure you're getting your bang for your buck. And it's something that we have really worked hard on is, okay, we want to teach your staff some best practice work methods for doing housekeeping, for example. Like we've got a good workshop for custodians, right? So sure, I can bring all the custodians in a room and I can talk about a PowerPoint of all of this stuff, but it doesn't necessarily mean that they're going to go back to their job and be able to put it all into play. So I do think that whenever possible, if you can do training out in the field, like in the employee's actual workplace, I think you're going to be able to make it more relevant. I think that you're going to be able to make it more specific and customized to them, and you'll be able to actually use their equipment and tools and their own work environment to actually go through and problem solve and practice, right? So to actually put theory into practice, like that's kind of where it becomes a training session. It's not just necessarily knowledge and education. Now I'm actually making it a training session or a workshop. So yeah, I think that there are some aspects that you might be able to consider doing. You don't have to do 100% of this session on the line, but thinking about what would be practical. Again, if you have always pulled your staff off of the floor or off the line into a classroom to deliver training, just thinking about, hey, is there a different way that we could do it for at least a portion of the training? I just think that it's a really interesting question, and it's an opportunity really to change what you've been doing. But really begs the question is, what is best practice for frontline staff training? And like I mentioned, this is a question that we've really been focusing on a lot. Like, maybe you have staff at multiple locations. Maybe you have hundreds of staff. Maybe you only have 10 staff. But we've kind of done some work with our clients and trying to figure out, what might be the best way to do this. And so what we have definitely found is that doing training in the actual workplace versus the classroom works a little bit better. What do I mean by better? I mean that we actually get to practice. So if I am teaching your roads crews, for example, on how to improve their work method when they are lifting, for example, so they've got to unload and load their truck. Maybe they are digging, they're handling pipes. Maybe your frontline assembly staff are where we did the training session also for like a lumber yard. So people are handling lumber, like long pieces of wood. We've done training sessions for the frontline like assembly staff where there is like a 60-second cycle time, but actually going out onto the floor or out into the field or even in a parking lot with their vehicles around and actually doing the training session with their own equipment really works. And so a good example is that information, that theoretical component of the training could be done in the classroom. And we have delivered that in the classroom, right? So getting people all together in a room and kind of a large group of people and giving them that basic information. Possibly you're doing that online as well too, but again, thinking about what works and how many staff you need to deliver that that information too, but then breaking them off into smaller groups to be able to really focus in and do that hands-on training that is customized to their work area. So that's kind of what I mean by this Ergonomics 101. Ergonomics 101 would be your basic, like, what is ergonomics? What are the MSD? What are MSDs? What are MSD hazards? And then just kind of briefly touching on how does it apply to me. But this is something that you might want to consider how and when you deliver it. So is it something that all employees get upon orientation? That way then you know that everybody who's coming into your organization is getting that same information, you know, and so when you sit in orientation, likely you have people from, you know, it doesn't matter where you're working in the organization, everybody comes into orientation together, and they're all getting some basic information about health and safety, the company itself, some policies and procedures, and then maybe an overview about ergonomics. And then when they go to day 2, or I don't know, I've seen orientation done a zillion different ways depending on the company, but when they get into their actual work area, then maybe there is like an ergonomics part 2 where they're learning more about specifically how ergonomics applies to them in their actual job. And that could be a classroom setting, that could be an online module. You know, any kind of session like that, again, if we're giving a lot of theory, I would say to try to keep it short, maybe not so short, like I don't think you can necessarily cover it in 5 minutes, but an hour would probably be a bit overkill. Possibly you are doing it more like a lunch and learn. Possibly you are doing it in small groups, almost like a safety talk, maybe on the shop floor or in the field, where you're picking a couple of different components. So maybe we really do only have 5 minutes and we want to start talking about ergonomics a little bit more. Then we just pick one component, you know, the definition of ergonomics, or what is an MSD, or you can pick something like a really small component of some of the sections that I've touched on, and introduce that more into that small group setting. But that way then kind of everybody gets the Ergonomics 101, and then you're kind of switching off into that more customized, or that part 2. I think that is really the way that I look at it the most, is it's like a part 1 and a part 2. And the part 1 is kind of that, what's that general information that everybody needs to know? And then customizing it, what is it that you need to know specifically for your job? So if you work in the janitorial setting, you know, we've got a great workshop where, you know, there are some slides that go through that, what is ergonomics, and then we break out into groups and we talk about mopping, make it very workshop and very hands-on. And at one station, we talk about mopping, and we make everybody practice doing mopping. Even if they've done mopping for years upon years upon years, we make them get out a mop and practice mopping, kind of using the principles and the techniques that we have been talking about as a group, right? Applying ergonomic principles. Right? I also believe that if you don't use it, you lose it, right? So you get all this information, but if you're not actually doing something about it, are you likely to remember it? And then they would rotate through stations, right? So sometimes this training takes a little bit longer depending on how many stations or topics you want to cover, but you know, you could move through stations like mopping. Maybe another station is emptying garbage bins. Right, the big ones or the small ones, and just tips on lifting garbage or relining the cans, preventing the suction. Maybe there's another station that you go to that's on moving furniture, right? Maybe they're the ones that set up your meeting rooms. They move the tables around. So it's talking about how to move tables, right? So there's lots of opportunities here. And you could do that similar type of workshop style. I like calling it workshop, or small groups, or really making it hands-on examples if you've got the time. And you could do that for, you know, all of your different groups. In packaging, right? You can flip between, maybe it's 2 different stations, and here it's kind of like talking about upline and downline, right? And that's what you're going to talk about. So it's loading the line with the product, or how to palletize skids when the product comes off the line. Right? And you've got 2 different groups, but everybody does everything, so you kind of flip between it, and you're able to talk about the ergonomic principles very specifically for those tasks. And maybe there are some other specifics, right? So if, say, you are talking about lifting, this is probably what we've been doing the most training on recently, actually, is manual material handling, and just trying to figure out, like, oh, people will tell us, oh, we do training. Yep, we do training on lifting. And it's like, well, how do you do it? And are you actually seeing injury reduction? Like, are you actually seeing that people are using good lifting techniques? Or are you kind of checking off the box that, yep, we've done lifting training And yeah, but I don't actually see people using that good of lifting technique. Well, that's sort of a problem because what it means is that your training isn't actually working, right? Ideally, you're learning something and then doing something about it, right? Doing something new from it. So material handling doesn't necessarily do well when it is just a poster or an online module, but we've been getting some really positive feedback on our workshop style manual material handling training where we are using actual work items. You know, we're in their workplace, we are using the parts and equipment, practicing loading a box, loading and unloading a truck, actually getting the group of employees to talk amongst themselves and problem solve, getting them to kind of think about what are some of the heaviest or more awkward things, and then again, kind of using it as a discussion group to figure out how we might be able to improve that. Right, within their own control. Now, sometimes it comes up where, you know, you see something and it's like, well, it doesn't, you know, this has happened for sure in a training session actually where, you know, we've seen something, and as much as I'm trying to tell you that you can use good technique and whichever, the reality was that this object was, I think we weighed it at like 55 pounds and you had to lift it to a height of 55 inches, which is above kind of at shoulder height for a lot of people, and the shelf that they were putting it on actually wasn't stable. It was one of those roll-out shelves, so it didn't matter how good your technique was. The reality was is that it was an awkward lift, and then ultimately what happened is that we kind of used that training session. We worked on some other tasks as well, but that one was one where we documented and discussed with the supervisor, and it was something that was just brought forward as an opportunity to fix as well. So it doesn't, you know, technique isn't always the solution, but there are lots of things that the employees can do within them. It also sort of empowers them too, now that they know that it doesn't matter what they, you know, it's not just about them, it's not just about them using good or bad lifting technique. There was something sort of flawed in the design of that shelf, and it sort of gave them the voice to speak up and try to do something about it. So that can be an outcome of your training as well. Ergonomics would also apply, so think about some of your field workers or maybe some of your sales reps, the people who are not necessarily out, or not necessarily, sorry, on the shop floor, but they are frontline with your customers and your clients. And so vehicles or ergonomics, maybe it's their own vehicle or maybe you have a fleet of vehicles, but actually going through how you might adjust that vehicle to make sure that they are minimizing their exposure to MSD hazards. So using good posture, they're not slouching, that they're still safe while they're driving. And this session is actually quite fun. We've done it in a couple of different ways. One was, this one here is a picture of Jen actually doing this training session as part of a wellness day. So in the big garage there, we had like this equipment here. So we had some big machinery. We also had just a small fleet car, this was at a municipality. So we had a town car, and we also had a pickup truck. And I think maybe we had two pieces of these bigger equipment just because it was harder to get in. And we had people kind of rotate through and they would be setting it all up. And again, just trying to think about some of those ergonomic principles and apply them. So even people who don't really drive all the time for work, this was a really, the feedback we got that it was really appreciated, because even for the people who commute to and from work. So the first thought was like, well, I don't drive for work. Like, I don't need to go through this. But I think reality is that everybody was able to take away some tips. Computer workstation, again, this is like your office ergonomics, and it is super common, super common to see this delivered as an online module or some kind of self-guided learning where, you know, you read on how to set up your office workstation, and then that's it. You kind of do it on your own, do it yourself. And so something, if you're looking for some ways to kind of do this out of the box, is try to make it practical. You could do this in a class setting. You could bring a mock workstation in there. You have people bring their own chairs to the session, or if you don't necessarily have the space for that, have one or two chairs in there, and we can talk about how to set up their computer chair for them in the session, right? Kind of going through all the adjustment features. A key thing here to really make it stick is to think about how to make it practical and how to make sure that people are actually going back to their workstation and trying to make changes. And so consider doing some kind of a follow-up or an assessment afterwards, right? So whether that's yourself or if you have run in an ergonomist, is, you know, delivering the training session, giving them almost like a checklist to make sure they go back to their workstation and go through those principles, and then you follow up, right? You go around and you toured everybody's workstation and just kind of make sure that they don't, you know, did you do it as per the checklist? Do you have any questions? Was there anything outstanding? And it kind of gives people a reason to do their homework, is what I like to say. So let me just give you a recap, because I know I talk a lot, talk fast, but the recap of this session was really trying to give you some ideas on how you might be doing some frontline staff training and delivering some ergonomics awareness training to them, right? So what is your goal? Are you just passing on some information on what is ergonomics? What do you want your staff to get out of it? What do you want them to do after they leave the training session? So again, are you kind of providing some education on a new policy, a new procedure? Do you want to be teaching them some new work methods or reviewing work methods like lifting techniques? So just kind of coming up with that kind of goal in the beginning is going to help you to plan your content, right? So you're going to have that general overview in the background, and then I really can't stress enough that you might want to consider who's all in the training session and how you might make it customizable to those very specific groups of frontline staff training, right? You're likely to going to give it in group settings, but really to think about that setting, whether it's in a classroom, is it on the shop floor, is it a mixture of both? Are you going to deliver it online? I mean, there are a lot of options, but again, to consider that, you know, how's all the other training done in your workplace, right? Do you do a ton of online training? And now we're going to be talking, you know, and we've said above that your goal is that you want people to be able to, you want to review some work methods and have them come away with some injury prevention strategies. Well, guess what? Classroom and online is not likely the best way for that. So really consider the setting and that format that's really going to maximize your engagement. And if you're not even really sure where to start, even what I might suggest is just think about a training session that you've been to, right? Think about whether it was like at a conference and you were listening to a keynote, or it was just a session that you went to in your current workplace, in a previous workplace, maybe something that wasn't even work related, but you went to a session and you really liked it. What was it that you liked about it? Was it just the content itself? Was it the presenter? Was it the fact that it was hands-on and memorable? You know, what was it that you really liked and that made it memorable? And then really, I mean, I guess that's almost like some professional development, even for yourself, is to figure out how you might improve upon your delivery of training. Yeah, that's kind of the recap. And also knowing that like you can deliver a lot of that training yourself, and there are resources as well. I mean, we are definitely a resource for sure, but you may not necessarily need us for everything. There are lots of things that you might be able to do in-house if you are not comfortable in doing it, or you are feeling overwhelmed, or hey, maybe presenting in front of a group isn't really your thing. I mean, that's totally where you would go to the resources or somebody who does kind of specialize in that to get some help. And on that note, I should mention that we are having a conference coming up in June. You know what, it's the 5th annual. So as I'm going to talk about this conference here for a second. If you guys have any questions and you've been listening, please feel free to type them in on the chat bar, and then I'll talk about the conference and then I'll answer the questions. So our conference is coming up in June 2020. It is our 5th annual Industrial Ergonomics Conference, where we focus a lot on industrial and manufacturing ergonomics. Not going to talk necessarily about office ergonomics all day. It is very much a networking and a learning session for industrial and manufacturing. And so I'm going to send out an email to everybody who's registered, and it'll go out after today's session. And so if you are interested in learning more about the session, please visit our website, proergonomics.ca. You'll see some preliminary information that we have posted. And if you want to win a free registration, all you have to do is reply to the email that's going to come to your inbox after this session, and just reply, yes, I want to win. And we'll be able to get your name entered into that draw. At that session, we're also going to have a new exciting launch. I can't tell you too much about it just yet, but it is something that we are super excited about that has a lot to do with simplifying how you identify and track and implement controls in your workplace. We are currently in the works of getting some more details out, so really I'm just going to leave it as a teaser like this, that it is coming soon, and our goal is to be able to give you all that information in June, launching at our conference. So thank you everybody for listening. I'm just gonna check over here for any questions. Okay, I have one question here. Actually, I'll read it out so that everybody can hear it, because I think it's just sent to presenter. It says, how long would you estimate that a workshop session would take? Okay, so I'm going to sort of interpret that to mean how long do you think this ergonomics awareness session would take? And I will give you an answer that it varies. I think that your theory component, where you were talking about what is ergonomics, what are MSDs, what are some MSD hazards, kind of that basic content, you should be able to deliver in under half an hour for sure. Like 20 to 30 minutes. Let's say you were doing that as an online module that people were going to tune in to listen to. I wouldn't want to see that type of content go any longer than that, because I think that you're going to start to lose engagement from people. But if it was going to be an online module, maybe try to make it a little more interactive with questions and animations. And then if it was more of a classroom setting, again, I would try to keep it at that. The kind of how I've been talking about it today in like a part 1 and a part 2. So that would kind of be part 1. And part 2, I would be hesitant to give you an exact answer in terms of how long it would be. It would depend on what topics you wanted to cover. If we were just talking about the manual material handling for a very specific product or a very specific work spot, then I might say that you could do it in a half an hour or an hour. You would never want to rush anything like that. So it kind of depends on, I guess, how much content you'd want to cover, but and how big your group was, right? Making sure that you're thinking about giving everybody an opportunity to do some hands-on. So if you have a small group of 5 people, it won't take as long. If you have a group that's bigger, like 15 or 20 people, and you're all trying to get them to do hands-on, then it might take a little bit longer. If any other questions come in and maybe you haven't thought about them right now, you think about them after the fact, you're always welcome to email us or give us a call. It's info@proergonomics.ca, and our information is on our website as well. Next month, we are going to be talking about ergonomic improvements, seating improvements. So this is a webinar where we are going to focus on projects that we've done. So projects that we've seen in different workplaces, sort of like case studies, but times where we've come in to help. They've tried to do some ergonomics. They've tried to put in a solution. Maybe didn't work the best. And so kind of going through the pros and cons of, you know, what makes a good solution and when basically trying to get it right the first time. So that'll be an interesting session. I'm looking forward to that one. Hope that you can all join us again. That registration should be up on our website now. And that's March 26th at 11 a.m. That's after March break. So there's our information. If you, oh, I see a question. Another question. Time? Yep. Time. Oh, I can't see the question. Oh, thank you. One question, will we be getting a slide deck at the end? I've recorded this webinar. So if you're new to tuning in with us, we record our webinars and we actually have our little Pro Ergonomics YouTube channel. So you will be able to view that at a later time, share within your organization, look through previous months. We always do these webinars monthly, and we always do them free, and so you should be able to find information there as well. There it is. I don't know why it looks so small on my screen. You guys can't see that. Have you done any work with long-term care or paramedics around working with patients as the material being handled? I have some ideas, but the challenge is often that it's a reaction that leads to the injury, i.e. the patient is falling, worker attempts to catch, stabilize. Absolutely. I definitely focused not on healthcare today at all, but that would absolutely be how you kind of customize the you're right, the material or the object. So if I was talking about patient handling and safe patient handling, I would be talking a lot about movements that the worker could do, so the nursing or the paramedic staff. What are some techniques, some body postures, some movements that they could do when interacting with the patient? Some things that I know you're kind of questioned about the reaction side of things, but I would talk about sort of that foundational, the working smarter, not harder, making sure that they know what tools and resources that they have available and making sure they're comfortable in using the different tools, whether it be patient lifts or slider sheets or the height adjustable stretchers, right? So making sure that they know how to use all that equipment. And then also to go along with that reaction, a lot of that comes down to sort of doing an assessment ahead of time, right? Ideally trying to prevent themselves from getting in that situation at all. But if that reactive situation happens, making sure they have some strategies and tools in their head so that they can prevent an injury from happening, like knowing how to respond when they feel that a reactive situation needs to be made. So long story short, yes, definitely we can do some training that is around patient handling, although I didn't talk a ton about that in today's session. Great, okay. As I mentioned, if there are any other questions, please feel free to email us or give me a call. And again, an email will be coming out to all of you. Thank you so much for attending today. The email that's coming out today will ask if you're interested in the Industrial Ergonomics Conference. And so if you would like to get entered for a chance to win a registration to that, then please reply. And if you are not the lucky winner, I will have to tell you that it's not a super expensive conference. We have an early bird pricing on right now until the end of March, and it's under $100. So it's very affordable for a day, and it will be in Mississauga, Ontario. So yeah, hope that you can join us. And thank you again, everybody, for tuning in. I hope that you have a great day.